Did you know that the United States has the highest mortality rates for preventable conditions and the most people with multiple chronic conditions? This, according to a recent Commonwealth Fund report and the National Center for Chronic Disease Prevention and Health Promotion. These statistics matter because evidence shows that healthy lifestyle behaviors can reduce the risk, delay, or even prevent most chronic diseases. In 2020, I began to think of lifestyle wellness in a new way, thinking critically about the supports and barriers for older adult populations at risk for chronic disease, what systems and programs were in place, and who are the leaders in this area. I'm an occupational therapist, an OT, so I wanted to know where OT fit in this equation. And finally, how did other healthcare professionals feel about this issue? For my study, a qualitative phenomenological approach was used, and in-depth, semi-structured interviews were conducted with multiple healthcare professionals to determine how they perceived lifestyle wellness programming, collaborating with other healthcare professionals outside their discipline, also called interprofessional collaboration. Also, I wanted to know if they associated these wellness programs with occupational therapy. I didn't want to merely summarize their statements or infer what they meant, so I used an open and axial coding process to analyze the data. This means I highlighted thousands of words, grouped the words together according to frequency, found common meanings, and then ultimately common themes across all interviews. So what were those common threads? First, these healthcare practitioners viewed lifestyle wellness programs as beneficial to clients, yet they acknowledged they did not have a complete understanding of all the programs out there, despite having some experience and exposure to them. Interprofessional collaboration meant mutual respect for every discipline's role, working together with a shared vision of better wellness outcomes and easy, effective, and efficient lines of communication and referral processes. It was surprising to learn that they had a limited awareness of OT's role in preventive care. In fact, they did not even associate OT with lifestyle wellness programming. They perceived OT as a service for those who'd had a sudden decline in function, usually after hospitalization. And they associated OT with intervening for activities of daily living, upper body, or fine motor work. Once they learned that lifestyle wellness is a big focus of OT, they welcomed future collaboration, and they wanted more information and invited opportunities to do so. So what does this all mean? It means OT practitioners can take this as a call to action, from enhanced messaging, education, program development, to advocacy for funding and policy change, and yes, even more research. Perhaps these findings helped reinforce the value of teamwork and diversity in healthcare practice. There's power in numbers, and together we can create some waves in America's healthcare system, shift the focus to lifestyle wellness, and change the trajectory of health outcomes once and for all.